everyone, Shana Tova, Happy New Year. I wish I could see you in person, but I'm glad to be visiting you in this way. So much has happened over the last few months, and it felt like an important moment as we head into this new year to update all of you on the important work that CJP has been doing. It has not been easy. In fact, it's been very hard at times, but we do feel like we've made a difference for so many people in our community. And it's really only because of your support of us as professionals, your generous philanthropy, and your belief in our role and your commitment to us that it's been possible. So I wanted to update you this afternoon. So since the pandemic hit, I think we've been doing three things at CJP. One is that we reacted along with the rest of the world. We did not see this coming, but we did react, and we did it in real time. So I want to share a little bit about what that was and what that felt like. The second is that we were able to take a step back, even as we pushed forward, to try and learn what is happening, what matters to people, what are they seeing, what are they feeling, how can we be more helpful? So I want to share those learnings with you, hot off the press. And the last thing that we've been doing is really trying to be proactive. We have reacted, we have learned, but now we can be proactive. We can think about what is coming around the horizons to the best of our knowledge, what is CJP's role, and how can we support those in need in our community. So while we continue to innovate and think about the exciting opportunities in our community and across Jewish life, today I really just want to share with you how our community is doing, people to people, together, just sharing with you the impact that we have made. So thanks for listening. So let me start, Chrissy, by sharing how we reacted to COVID-19 at CJP and across our community. So we go to the first slide. Next one. So we put together a dashboard, and we wanted to share it with you around CJP's impact and the work that we did when the pandemic first hit. Thanks to your incredible generosity. I mean, we were completely floored, honestly, although we know this community is incredibly generous still, to have over $4 million to send out into our community where it was needed the most. And our community is right here, our beating heart here in Boston, where we did a ton of direct client support, food, clothing, shelter, making sure people know that we see them in their most desperate hour. But our community also extends across the globe. We saw our sisters, brothers, friends in Haifa. We saw them struggling as well and thought and responded to their needs. And we saw our sisters and brothers, friends and family in Dnepropetrovsk, our other sister city, and we were able to respond to their needs as well. We're incredibly proud of this human-to-human response, but it was reactive, it was in the moment, and we were able to send $4 million out, and it still didn't solve every problem. So we then had to take a step back and think, what is happening to our community? How is COVID-19 impacting each of us? And so I wanted to share some learnings with you, even as we went through this impressive reaction to this. So Chrissy, if we go to the next one. So the first thing, usually when we say learnings, we think we're going to see lots of data, but the very first thing that we learned is how much it matters to our community to be seen and heard in this moment. I received this note from Marilyn a few days ago. It was one of hundreds, literally, of notes that we received at CJP after we sent out, as part of that emergency response, over 2,000 hot meals for Rosh Hashanah. What mattered to Marilyn, as you see here, is that she got a delicious lunch. But the part that really strikes a chord for me, that makes me want to cry every time I read it, is the part that says, but more importantly, for remembering. So much of our Jewish identity is tied up in how to remember the past, how to think about who we were as a people before we came onto the picture, and then how to integrate that history of remembering into a vibrant future. That's what this lunch was for Marilyn. As she ate her lunch, yes, it was delicious, and yes, it was Rosh Hashanah, an incredibly important day on our calendar. But she also felt as if CJP, and by proxy all of you who have supported us in so many ways, were eating lunch with her, and she knows that we remembered her. So the very first thing that we've learned is the importance of demonstrating to people that we see them. And I can't undersell what it meant to Marilyn and what it means to us as professionals to be able to do this work on your behalf. But we did really learn from hard data as well. So Chrissy, if we go to the next slide. CJP was very proud to partner with the Cohen Center at Brandeis and with national foundations all over the country, federations, to support a study of the impact of COVID-19 in our community. So here's a sneak peek into some of these data. First and foremost, you see that 5,000 Jews across the country have passed away. This is an astonishing number. We need to take pause and remember all of those people's mother, sons, brothers that have perished, and we need to be cognizant of what that means for so many of us who still remain alive. The other piece to note, which might not be surprising but is important to us, is that those people who were struggling before continue to struggle in much more real and visceral ways. So people who were struggling financially, as you can see here, are struggling more as a result of the pandemic. We are so proud of our anti-poverty work here in Boston. After the recession in 2008, we did not sit around and we did not wait, but we took action, and we created a system here in Boston where together organizations carry the burden for clients and support them in reaching self-sufficiency and stability. That foundation, which is replicated in 7 cities across the United States right now, has served us incredibly well and was the reason we were able to send $4 million out the door to people who need it right away. What has startled me the most, really shocked me actually, has been the findings around loneliness. I would have expected to see that the older you are, the more lonely you felt, knowing that so many people in our older adult communities have not been able to leave their apartments or see their loved ones or give someone a hug. But actually here we find that yes, for sure, older people are struggling and are lonely, but people who are under 35, both here in Boston and nationally, are the saddest and often the most scared. They also are by themselves. They also may not be leaving their apartment very often. So this is where our data becomes so important. We don't just read it, but we have to live it. We have to live the values that we espouse. So if we are committed to the next generation, this generation, then we need to take these data and we need to create actionable strategies to meet people where they are. And where people are right now, particularly younger people, are in moments of loneliness. So we want to take action. So let me give you one taste of what that's going to look like. We know that the foundation, as I said, around anti-poverty is strong. We also know in our anti-poverty work that 48% of our clients have a mental health struggle that they are dealing with on a daily basis. That finding, combined with these data that we're sharing right now, really are motivating us to become much more serious as a community, with CJP as the backbone, to fighting mental health. We're not direct service providers. We are not going to be able to solve mental health issues for everybody, but we can ensure that our community knows that we see them, that we remember them as whole humans, and we want to meet them in these struggles that they're having. So Chrissy, if we go to the next slide. We're very excited to announce a brand new partnership with McLean Hospital here in Boston to pilot a brand new virtual cognitive behavioral therapy strategy on our anti-poverty initiative clients. 300 of our community members will take part in this research-based study that will be published, and the findings of which should be spread throughout the United States and even globally. Imagine if this pilot here in our own community not only meets the needs of those people that are closest to us here who are struggling, but actually the findings impact people globally. It's an exciting position to be in, and it's one that we feel really builds on CJP's strengths as a backbone organization. But the data that I just showed you said that younger people were really struggling, and they don't necessarily have the same financial challenges, although they might. So we are excited to be working on teen mental health strategies. We know that we need to be reaching into the day schools, into camps, into synagogues. We know that our Ruderman Synagogue Inclusion Project has mental health committees in every synagogue. How can we make better use of those? The national data are startling that tells us that Jewish substance abuse, like all substance abuse right now, is over 50% of the American public admitting that they have a substance abuse problem. And that ties to the loneliness findings, I'm sure. We do not have substance abuse support here in Boston. So what will it mean to add that to our ecosystem? And then what would it mean for somebody who's struggling, who needs someone to talk to be able to call their rabbi, to be able to call a day school head, to be able to call a camp director and say, I need help? What would it mean to have a community-wide referral system into a mental health environment that would support you? It might not solve every problem, but the problem of referring people into a complicated medical system is a challenge. Our community needs to meet people where they are, and right now we are struggling. So we take it very seriously at CJP that if we see you and remember you as a full person, that this type of work as an ecosystem response is exactly the work that we're best positioned to do. We want to think about people as individuals. Marilyn, we see you, we remember you, we were there with you to eat lunch, but we also want to think about organizations coming together to make a bigger difference. That is, after all, our slogan. So I want to thank you for believing in CJP in that middle circle. I want to thank you for the generosity that allows us to have these innovative, groundbreaking pilots. But more importantly, I want to thank you for remembering all of our friends, our relatives, our community members at this time. They need to know that you care. It's our job to make sure that we pass that message along, and we promise to be your partner in this incredibly important moment. Thank you.